Hi, my name is Dr. Gerald from Elite Dental Group, and I'm happy to answer any of your dental implant related questions. There is no simple way to answer this question. This is a question that I get asked quite often. The short, quick answer to it is no, it doesn't last forever. But let me explain using this. A dental implant has three parts to it, which is the implants, the abutment, and the crown. So anything that we place into your mouth is subjected to wear and tear, and most dental implant systems are designed in such a way as to allow for maintenance of the crown and the abutment should they break or should they be damaged with wear and tear. So the implant parts is designed to last longer, but the crown part is actually designed to be replaceable. Having said that, sometimes because of poor oral hygiene or because of gum disease, you can get an infection around the implant, and in such a situation it's possible that the implant is lost as well. So in reality, although it's designed to last very long, but there are certain instances whereby the implant does not last, and we always tell our patients that to be prepared for a day when we have to replace the implant or the crown. Well, to ensure that your dental implant lasts for as long as it's designed for, you really have to follow a few steps. The first step that you need to do is to go back to the dentist or the surgeon that placed the implant regularly for maintenance. So when you have regular maintenance checkups, your dentist would be able to pick up problems in the implant early before you can detect it yourself, and the dentist would be able to treat all these early problems and to remedy the issues before it becomes a big problem. The second thing is, of course, home care. And as you can see from this model, you can get gaps around the implant that you really need to floss through and to brush through. So having meticulous oral hygiene at home really goes a long way to helping to maintain the health of your implant. And lastly, I can think of one more thing that you could do is to avoid actually biting on very hard things using the implant. Some people have bad habits of crushing down on ice, on chili crab shells, on chicken bones, and generally we would advise our patients to avoid biting on these hard things. Otherwise it may put a lot of stress on the metal or some of the joints like the abutment. So these are the three main ways. So in conclusion, dental implants aren't as straightforward as many people think. A lot of factors need to be considered before a patient is declared fit for the surgery and before we can actually take informed consent. There are cases whereby we do implant surgery in compromised sites where the bone is too thin, when the gum is too thin, and in cases like that we always warn our patients that there is a chance that the implant will not last as long as it's intended for. As long as patients make an informed decision and their expectations are managed, then I think we've done a good job. However, on the other side of the spectrum, there are implant surgeries that can be done very simply with not much complication, with very high success rate. So it really depends on the patient, the unique circumstances of the patient, the unique circumstances of the surgery site, how healthy the bone is, how healthy the gum is, whether there's a stability in the bite. There are many factors that a good dentist should discuss with their patients before actually attempting any kind of surgery. So I hope you find that information useful, and if you do need dental implant surgery, please find a good dentist with good experience in the surgery and have a good deep conversation with him.